Hi, everyone. Welcome to the self-defense webinar with a pediatric and prenatal focus. So we are going to chat all things immune systems, and I hope that this really just gets you thinking for yourself and asking the questions about what the immune system is, what dysfunction of it can lead to, how we can boost it, and really most importantly, how to get our body healing at its highest level. So I do want to hit on the fact that Dr. Brent did a webinar last week on this same topic with more of an adult focus. So I would highly encourage you guys to watch that. He shares really great information, really for the whole family. So I want you to make sure that you are watching that. But I want to chat first about what the immune system is. So the immune system has a vital role in fighting disease-causing germs, which are otherwise known as pathogens, like bacteria, viruses, parasites, fungi, and it removes them from the body. It recognizes and neutralizes harmful substances from the environment, and it fights disease-causing changes in the body like cancer cells. So our immune system consists of really specialized defense cells and proteins, organs, entire organ systems. It is our first line of defense. It is our shield to our outside environment. So it is very important that our immune system is just working the best that it can be. Alrighty, so I want to introduce myself a little bit more and introduce Dr. Jill, who is with me on this picture. Dr. Jill has been in practice for over 11 years. She is prenatal and pediatric focused, has worked over 200 hours toward her pediatric diplomat. So she is really someone who I consider an expert on a lot of these topics. She is Webster certified. We are working on SOT currently together. And she's doing all this while being an amazing mom, business owner, and a great doctor as well. I have had the joy of being alongside her and the rest of our team for over 2 years. I am also focused on prenatal and pediatric, but recently I felt a pulling on my heart to really jump into women's health in general and really take a deep dive into women's hormones, pre-pregnancy, during pregnancy, postpartum, and really just women's health in general. So I'm very excited to jump into this. Let's talk about immune system disorders. It is so much more than just getting sick and strep throat and colds and all of those really fun things. It is all things from type 1 diabetes to allergic dermatitis, allergies, food allergies, Crohn's disease, ulcerative colitis, so a bunch of digestive issues, and even really big things like cancer going on. So these are really common things that I see, but they are not normal. So I'm going to hit on that again. They're very common, but not normal. These are things that I see and hear about on a daily basis, and they're really steadily increasing. Studies shown that over 40% of school-age kids and adolescents have at least one of these chronic health conditions, which is really scary. We think of these things being adult issues, but they are becoming childhood illnesses that are going on. 1 in 8 kids have asthma. 1 in 5 children have allergies. 1 in 12 children have food allergies. 1 in 5 children are overweight and battling digestive issues. And another study is around 93% of kids suffer from digestive issues related to food intolerances like gluten, lactose issues, dairy issues, all of those big things. And that stems from a digestive issue going on. Okay, so really big things are happening, and I made it my personal mission in life to make sure that this isn't reality for all kiddos. So let's chat about what destroys our immune systems. 4 big things, but there are multiple other things. C-sections being a very common one of this. So we're going to chat a little bit more about this later on in this webinar, but babies are brought into this world sterile, meaning they don't have bacteria in their bodies to help boost that immune system and fight other things. So they get it from their mom going through that birth canal. So it is very important that they are getting that good bacteria through there. And you can imagine if you weren't going through that birth canal through a C-section, you wouldn't be exposed to that. So we're going to chat about that a little bit more later. Second thing is antibiotics. Antibiotics are given out on a really common basis for a lot of different things, but we're not just getting it from medications. We're getting it through mothers. They can pass it through that birth canal. They can get it during labor. They can really get it from breast milk, they can get those antibiotics, they can be given to them, they can get it through antibiotics that animals have in their system, and even through hand sanitizers and soaps that we are using. So it is constantly around us, and that is really destroying our microbiome. It's killing good and bad bacteria. So very important that if we are exposed to these things and if we are having to take an antibiotic, that we're replenishing our bodies through other things that we're going to chat about. Another big thing is food. Processed foods and chemical-filled foods are not fueling our body. If we want to be functioning at our best level, we have to allow our body to get those nutrients to work at the optimal level. So sugar, processed, damaged foods are harmful to our bodies, and they're actually creating these diseases going on. Bad bacteria in our body thrives on sugar. So if we are constantly eating sugar, we are actually not allowing our body to get rid of that bad bacteria. We're only increasing it quite a bit. Studies shown also that our immune systems are suppressed for 5 hours after eating sugar. So you can imagine that that's important on a daily basis, but especially if we are sick, we have to cut out sugar 100%, or we are only prolonging our sickness and even making it worse. The last thing on here is toxins. So all of these things that I talked about are toxins, but toxins in general overload our system and cause dysfunction within our body. So I did an entire webinar a couple of months ago about toxins. So I'd highly encourage you to watch that, educate yourself on where we're getting these toxins, why it's important to get rid of them, and things that we can do to prevent that exposure to them. Alrighty. So a very common question that I get is, why do some kids get sick and others don't? Within a house, within a school, wherever it is, some kids just get sick more than other kids. And why is that the case, essentially? So epigenetics is our answer. We know that 70 to 90% of disease comes from our lifestyle and the environment that we are in. This means that we have the ability to change it. Just because someone in our life has had diabetes or has had cancer or has had different diseases does not mean that we have to get it. Epigenetics is a really big focus on turning genes on and off. We have the ability to turn genes on to have diseases and things like this, or keep them off in our lifestyle or through our life. And that is really because of our lifestyle, the choices we make. And we really just need to hit on the fact that we don't have to have these things happen to us, but it will take a lifestyle change and really making sure that we're promoting health and wellness, essentially. So studies have shown that when we are exposing ourselves to all of this, that we are allowing these things to happen. So we can't blame our genes. We have to take responsibility for all of this. If we know that someone in our family has diabetes, we wouldn't want our kids to sit on an iPad all day, eat chips, eat donuts, drink all these sugary drinks, because they will absolutely get diabetes. We know that if we have it, we have to move our body. We have to change our nutrition. We have to turn off the expression of that gene, not only for yourself, but for those future generations too. So at the end of the day, it doesn't matter how many germs you're exposed to, really how many family histories you have of things. A healthy body and a healthy immune system should be able to fight disease. It should be able to fight off germs. It just depends on how your immune system is functioning and what you are doing to support it. So I said that we will go back to talking about C-sections and the microbiome, the bacteria that we're exposed to, and we're going to do that. So your gut is not just your digestive system. It is key to your mind, your mood, and your immune system function, actually. So our microbiome is actually acquired starting at birth. And up until age 3, it is really that big part of it. But even teenage years, that's when we are developing this microbiome. So very important that we are initially getting that good bacteria, and that we are making sure that we are constantly feeding it really good nutrients and really good bacteria. So there are some instances where C-sections do happen, or that we have to be on an antibiotic, and we're going to chat about how we can make sure that we are boosting that after. So we're going to chat about that in a little bit longer, but the good news is that we have the ability to do all these things, and 50% of dopamine actually and 90% of serotonin are made in the gut. So that is our mood, that is our thinking, that is how we are feeling and functioning on a daily basis, and 70 to 80% of our immune system is from our gut. Another great gut microbiome boosting thing is breast milk. Supports the growth of certain microbacteria influencing our immune system. So when a mom has a sickness or is currently sick, she's going to pass those antibodies and that good bacteria to baby. So very important that we're getting those from our mamas. Next thing that I do want to chat about is chiropractic adjustments. You could probably guess that I'm going to chat about this because it is something that I am very passionate about. Adjustments remove interference from your nervous system. So this allows your body to function and heal at 100%. If your body's working 100%, your immune system is going to be working 100%. And there is a study that shows that people who are in regular wellness care for 5 years or more, they have a 200% greater immune competence rate. So that means that their body is going to fight sickness better. They're going to be less likely to get sick. And if they are sick, it's going to be less intense and last a lot less than someone who isn't getting adjusted. So really great news with that. When our spine is in alignment, our bodies can just work how they're supposed to. Cortisol is a very commonly known thing because that is sort of stress hormone, and studies shown that getting adjusted actually helps use our ability to adapt to those stresses. So it alters the way your nervous system works, which then has an impact on your immune system. So get adjusted, very important. Another big thing that I talk about in the office are immune boosting supplements. So on top of taking a daily multivitamin and an omega, these are 3 really important immune system boosting supplements that I recommend. Vitamin C, D3, and a probiotic. So vitamin C helps produce white blood cells in our body called lymphocytes and phagocytes, which help protect our body from infection. So vitamin C supports cellular functions, both on the innate and adaptive immune system. So not only is it important on a daily basis to be taking it, but especially if you are sick with an infection, vitamin C would be a really important thing to increase. Vitamin D is another really great one. This is an agent that can help both regulate the innate and adaptive immune system. Vitamin D can help modulate the immune system and acts as a regulator to maintain a healthy response from infections and from sickness. So once again, a great thing to use before a sickness or even during a sickness. Studies shown that actually 50% of kids between 1 and 5 have a deficiency in vitamin D, and 70% of kiddos between the ages of 6 and 11 have that deficiency. So very important that we are adding that into our diets. The last one on here is a probiotic. Probiotic bacteria, that good bacteria, can actually help interact and stimulate intestinal immune cells. So really important that those immune cells are working how they're supposed to be, and a probiotic can help aid that. There is growing evidence that a probiotic bacteria present is important in health promoting and really the immune regulation properties in our body. So each kiddo age, anywhere from an infant to a toddler to normal just kid age, there are different bundles, and I put together a couple different ones depending on different brands that we all carry in the office. So I'm going to put those together in another post, so it's really easy for you guys to know what age and what supplements your kiddo really needs these things. But those are the 3 main ones, and I will have each of those in a bundle for different ages. It is very important to me that we know what we are consuming. So all of these have very clean ingredients, no additional fillers, and are specific for kids. So you can be rest assured that they are safe for your kiddos. Alrighty. So another just kind of final point that I do want to hit on is that our bodies are designed to heal and function at 100% when interference is removed. So we have to stop depending on these outside resources to give us health. Our power is within our body, and through chiropractic care and the other 5 essentials, we can really make sure that we are just thriving and healing and functioning the best that we can be. Alrighty. So some good action steps here. Get your nervous system checked. Strengthen your body's natural ability to heal and adapt to stresses. When we get adjusted, our body is going to be working. Our immune system is going to be working better. Take your supplements. So we carry multiple brands in our office with different options. So on top of that, multivitamin and omega, those 3 supplements, that vitamin D, probiotic, and vitamin C are the 3 really immune system boosting supplements that I recommend. And eat real food. It is so important that we are eating foods that are nutrient rich for our body and really fueling our body. So we have great resources in the office. We have an advanced plan and a core plan, which really lay out what are good things to be eating. They have recipes. There is all different types of things and ideas that are really healthy and great for the entire family. So let us give you those resources. We have those in our office, so please use those. Another big thing is sugar. We have to stop eating as much sugar, especially when we are sick. It is killing our bodies. It is killing our cells. It is making our immune system and other really important functions not be able to work the best of their ability. Okay, so what can we do to help boost our immune system through food, though? Probiotic foods, so homemade yogurts, goat milk, coconut milk, pickles, sauerkraut, anything that has that cultured bacteria in it can really help replenish that good bacteria. And the last thing, a little bit cut off here, is join our groups. We do a lot of webinars, seminars, nutrition guides, tips from the doctors. We want you to really use us as a resource and let us help you. It is not fair for us to assume that you know all these things, and we want to really make sure that we are educating you guys with all the up-to-date information that we have. Alrighty, so our last slide here is our resources. I put some of my information on here and Dr. Jill's as well. And then in the office, please feel free to always ask us questions. But I hope this was helpful, and I hope that it gets your mind asking the right questions. Disease is all around us, and it can sometimes feel like we have no way of avoiding sickness and avoiding these diseases, but we do. We just have to empower ourselves. So we have the tools, we have the resources to make this change. We just have to do it, really. So please reach out to us if you have any questions. We would love to chat further about this. We love educating our patients, and we hope that we can be just a great resource for you guys. So if you have any questions, please let me know. But it was so great talking to you guys, and I will see you next time.